see.
Okay, good afternoon, everyone. Welcome to the latest edition of Nashville General Hospital's Wellness Wednesday Facebook Live program. Thank you for joining us today. My name is Kathy Poole.
And I'm Kaylin Harris. Our goal of Wellness Wednesdays is to introduce you to Nashville General Hospital experts, have them share information vital to your health and wellness, and give the opportunity to answer questions during their presentation. Today's guest is Dr. Andrew Pierre, a podiatrist at Nashville General Hospital and the Nashville Healthcare Center.
Dr. Pierre is a fellowship-trained foot and ankle surgeon, board certified by the American Board of Podiatric Medicine. He earned his Bachelor of Science degree in Biological Sciences at Florida Atlantic University with honors, and his Doctor of Podiatric Medicine degree from Rosalind Franklin University of Medicine and Science with honors. Dr. Pierre completed a 3-year surgical residency training in foot and ankle surgery at MedStar Georgetown University Hospital and MedStar Washington Hospital Center in Washington, D.C., as well as a fellowship in reconstructive foot and ankle surgery in Columbus, Ohio. Today, he will share information on his practice, which focuses on reconstructive foot and ankle surgery, diabetic foot care, and sports medicine. If you have any questions for Dr. Pierre, please feel free to comment below. Please welcome Dr. Andrew Pierre.
Good afternoon, everyone. Like Kathy said, my name is Dr. Andrew Pierre, and I have a little presentation for y'all. All righty. So I'm not going to go through further of this introduction, as Kathy did a really good job with that. So I'll just get right to the nitty-gritty. So what is podiatry? All right. Podiatry is a branch of medicine devoted to the study, diagnosis, medical, and surgical treatment of disorders of the foot, ankle, and lower extremity. So DPMs, as we like to be called, we're doctors of podiatric medicine. So some DPMs don't like to perform surgery at all and are typically called non-surgical podiatrists. Myself, I'm a podiatric surgeon, also known as a foot and ankle surgeon. So I do typically like to enjoy both the non-surgical and, if needed, the surgical aspects of the field. So conditions that we treat, anything from bunions, and I'll explain what bunions are later on in the presentation, hammer toes, flat feet, arthritis. That's when the weather, you can feel the weather coming, that's arthritis. Sports injuries, fractures, complex diabetic wounds, basically any and everything pertaining to the feet, ankles, and the lower extremities. So with regards to diabetic limb salvage, I'm just gonna highlight that quite a bit because I see quite a bit of those in my practice. So it typically involves a multidisciplinary approach to treatment. So vascular surgeons are very important, plastic surgeons, primary care physicians, of course, to keep control of the diabetes, and podiatric surgeons. So this team approach has been documented by multiple peer-reviewed articles, and it shows that it decreases in major amputation rates by greater than 50% and an overall improved outcome for this patient population and better overall lifestyle. And so we do play a very important role in the treatment of the foot deformities and complications related to diabetes. So I feel that the best way for me to fully explain to you all what I do is to show some pictures. So everybody loves pictures. So the following is definitely intended for mature audiences and viewer discretion is advised. Okay, so this here is a picture of me when I was completing my fellowship training in Columbus, Ohio. And this patient had a chronic wound to his heel. He's a diabetic patient, chronic wound to his heel that unfortunately failed all wound care measures in the office. So what we had to do was basically harvest the muscle from his leg to essentially flap down to cover that defect in his heel. And then what we subsequently did was we put a skin graft over this muscle, which allowed it to heal. This right here, you see that little tube hooked up to it, and there's a black foam on it. That's called a wound vac machine. So at times we have to put a vacuum, essentially, on wounds to allow it to fill in from the inside out. So if I have any diabetic patients that are watching right now that have a wound that's just not healing, definitely give us a call, and we'll have the contact information at the end of this presentation. Here's another example of a diabetic patient here who also had an extensive history of smoking, peripheral arterial disease, meaning she didn't really have good blood flow coming down to her foot. So this is after surgery. So what I did was I actually put a cadaveric, meaning donated by someone who passed away that was an organ donor, skin graft on her wound. And with time, the wound underwent some changes, continually got smaller and smaller. Unfortunately, I don't have a completed picture. I just saw her last week, and she is, in fact, completely healed. So we do have plenty modalities and different ways to get your wound healed. This right here is an X-ray of a foot and a leg looking from the side. So looking on the right-hand side of the X-ray, you have the heel, and towards the left-hand side, those are the toes. So what you notice is it's almost parallel. If you look at the bottom of the X-ray, the bones, it's parallel with the weight-bearing surface of the foot, means that this is definitely an example of a flat foot. So we definitely have ways to conservatively treat flat feet by ways of, orthotics and braces and different shoe gear. However, sometimes patients need surgery due to recalcitrant pain, or recalcitrant meaning it's not improving pain, people who have failed conservative measures. And that involves a reconstruction of the arch. And here is this same patient where we have taken them to surgery and reconstructed the patient's arch. And now this patient is walking pain-free. Here's another side of it here. So what we did was we did have to make a cut, and hopefully you can see my mouse, but there's a cut here in this bone that we actually had to slide over. And this is a screw. I didn't get all of the screw, but you can kind of see the screw holding those two bones back together so it can heal. Over here, which you can basically better see on this view, I had to put a little graft, another one of those cadaveric bone grafts, somebody who donated their bone, to shift over that foot to cover this bone here. And in turn, it has this result in the end. And what I also had to do was fuse this joint over here. This right here is an example of a fracture, okay? Fractures are basically broken bones. This patient, I believe he was playing basketball. This was a young 20-something-year-old gentleman playing basketball, landed exceptionally wrong. He was trying to show off on the court, flex a little bit on the court, and unfortunately, he sustained a fracture. This is definitely a surgical issue. It's a very unstable fracture, so we had to take the patient in, and we basically put plates and screws to get those bones right on back together. Here's another example of a traumatic incident. This is he was also 20, I believe 25 years old, expecting father. His wife was pregnant. But anyway, he went ahead and he had an issue at work where his foot got crushed in a forklift, between a forklift and a piece of wood. And unfortunately, this area that's circled here is a fracture, what's called a fracture dislocation. And this is towards the back of the foot. So he was unable to walk or anything. So we had to take him to the operating room and basically do an open reduction, external fixation, meaning we instead of putting that hardware inside the foot, you'll see on this view that the hardware was outside the foot. So it just kept everything stabilized. And sometimes we do have to do this in traumatic incidents as well as other reconstructive surgeries as well. Oh my goodness, look at this. This is a shortened toe, very short toe. This was a 19-year-old young woman, who was having pain towards this region of her foot. You can definitely see that her big toe is really her little toe. And she did not like the appearance and how it felt. So we had to take her to surgery as well. And this is what it looks like on the x-ray beforehand. So in surgery, we had to make a cut in this bone, which really should be as long as this bone. Make a cut here, and we put another one of those external fixations, meaning outside of the foot. And over time, you'll see that there's some rings in this little external device here that the patient turns this and gradually elongates that bone that we cut. So unfortunately, this was during my fellowship training. Unfortunately, I don't have a completed photo of this, but I can attest that this patient did in fact get her toe aligned with the rest of the toes. And this right here, and I'll talk more about hammer toes in a second here, but that is a hammer toe correction that went along with that surgery as well. Bread and butter. Let's get to the bread and butter of things. We call this bread and butter podiatry. So I want to talk a little bit about bunions. What is a bunion? Bunion, this is the big toe. I don't know why this whole thing keeps coming up, y'all. I'm a doctor, not a computer technician. But this is the big toe, all right? These are the little toes. So some of you are walking around, you're like, what is this big bump on the side of my foot? It hurts when I walk. I can't put on certain shoes. Oh my goodness, what can I do about it? So this is what it looks like inside your foot, essentially. And sometimes you can get inflammation over here. This redness here and swelling is inflammation. This is not an accurate depiction of it, but this is probably what the illustrator was trying to depict here. Is an inflamed, what we call a bursa. It's a little sac, a little cushion that protects that area. And sometimes you can get an inflamed bursa, and that's what's really causing you the pain. So there are different severity to it. This is the University Foot and Ankle Institute guide for bunion. There are 5 stages of it. You have very mild all the way to crossover. We call these crossover deformities over here. Extensively severe issues, deformities. So surgery is actually the only thing that can really correct a bunion. You can buy any over-the-counter bunion splint, but it will not reverse the onset of the bunion, unfortunately. So most individuals who have a symptomatic, meaning a painful bunion, they would need surgery. And that is the only time that I would recommend doing surgeries if you actually have pain, not for cosmetic purposes, but only if you have pain. So this is an example of what's called an osteotomy in the metatarsal bone. And this is one of the big toe bones. There's 2 of them. And essentially what we had to do was make a cut in the bone, shave off the bump, and shift it over and put a couple of screws to hold it in place. And that basically reduces the bunion deformity. Now, there are some other ways of doing this. So that previous slide that I showed, this was the incision that essentially happened there. But now there are newer ways of doing the bunion deformity where we have minimally invasive surgery. So all you need are these 2 small little incisions at the side. And those of you that like to have wear your sandals and be more cosmetically pleasing, this may be a good option for you. This is an example of a patient who had a bunion, and you see what it looked like beforehand, and they had the minimally invasive surgery, and this is a small little scar on the side, and their bunion is corrected. And yes, you can wear heels after you get your bunion corrected. Hammer toes, I talked about that briefly before. So essentially what that is a curling of your toe. There are different names to it. You have hammer toes, you have claw toes, mallet toes. I just summed them up just to make it easy and call it a hammer toe. Everybody kind of hears that going around hammer toe. Curling of the toe, that can sometimes become a problem in terms of pain. Diabetic patients have issues. They can get a wound here or here. Even people who are not diabetic, you won't be able to wear shoes comfortably. You may get a corn here or here. So those are the types of patients that if you're having pain with it, we can definitely address that surgically. or with shoe modifications. So what does that involve? Okay, this is just an example of someone who had their hammer toes corrected. And all it involves basically is, I'm gonna go back to this other view here, making a small little cut up here on top of the toe, taking a piece of that knuckle out. And sometimes we have to fuse the little joint here, and you have a nice, pretty short little toe, not short, but pretty straight little toe thereafter. All right, that's no longer causing you that pain and discomfort. So that was kind of like a general synopsis of my practice. I do also treat ankles in depth, and ankle fractures, ankle arthritis, sports-related injuries associated with the ankle, diabetic routine foot care, any and anything pertaining to the foot and ankle. That's what I do. This is just a picture of me completing what we call a calcaneal fracture surgery. You can see the incision on the side here that I sutured up. But this patient had a heel fracture, a heel bone fracture that needed surgery. So that is pretty much it. Anybody have any questions for me?
Thank you, Dr. Pierre, for sharing. I think Kathy and I and everyone watching out there learned a whole lot about foot and ankle surgery. Definitely learned more than what I knew beforehand. So I definitely appreciate you. So while I am monitoring the chat, and again, if you have any questions for Dr. Pierre, please feel free to ask in our chat. But I do have a question
Yeah.
before we get some coming in. So, are there any corrective ways that someone can, or corrective things that someone can do at home to prevent some of the things that you mentioned? So, of course, don't, if someone has if their bunion becomes serious, then of course they should come to see you. But I know generally I've heard, don't wear small shoes or things of that nature. Like, are there any corrective tips that you have for someone who's, let's say, in the beginning phases?
Earlier stages of it.
Yes.
Well, yes. And this is mostly to my powerful, courageous woman out there. Okay. High heels. High heels is not your friend. All right. You can wear it on special occasions, but unfortunately, what high heels does is it causes a destabilization of some of the joints in the foot, which can lead to shifting over that bone that to cause that, the bunion deformity. So high heels, try not to wear too much high heels. Usually bunions are caused by actually a tight Achilles tendon, believe it or not. It's all connected. So what I would recommend is that you do some stretching exercises on the regular. If you do wear heels, make sure you follow that up with some stretching the back of your legs just to continue lengthen it out. You can Google some stretching exercises for the Achilles tendon. And I would recommend that you hold those stretches for at least 2 minutes to allow the muscles to really, really, truly relax. But yes, that is a great tip, and definitely don't wear narrow shoes. So if you notice that your bunion is developing, you may not be able to wear the shoes that you used to wear. You may need to get some wider shoes to accommodate the bunion deformity as well, and shoes with a bigger toe box as well.
Thank you. And we did actually have a comment come in, or a question come in from the chat. Do you see patients for gout?
Yeah, so with gout, what I see are the acute gouty flares, meaning it's very painful at the moment. So sometimes we have to give steroid injections, we give non-steroidal anti-inflammatories to kind of calm the gout down. But chronically, in terms of managing gout, that is actually the primary care physician. You need to follow up with your primary care physician for that chronically, because you may need to be put on a medication or to control that. We call that a uric acid buildup. That's what actually causes the gout. So there's a medication called allopurinol that's very popular that people who have chronic gout is on. So that is managed by a primary care physician or rheumatologist.
As far as some of the other items that you talked about, When does somebody know that they need to reach out to you, a foot and ankle surgeon, versus a non-surgical podiatrist? Or even like you were talking about diabetic foot care. Once you're diagnosed with diabetes, when should they see a foot specialist? Is that again something through the primary care provider, or should they be proactive and go ahead and like schedule an appointment?
Well, my thing is every diabetic patient should see a podiatrist at least once a year. And what we do is we have a risk stratification, meaning we put people in categories to determine what their risk is for developing some of those wounds that I showed earlier. And if you are at a higher risk, and there are different criteria, and we can talk about it in person if you come see me, but there's a few criteria for that. But if you're higher risk, I would see you every 3 months, actually, just to make sure and monitor closely so that you don't unfortunately lead to things such as amputations and development of those wounds. But some people, like I said, once a year. So if you are a diabetic, yes, definitely you can reach out to me. Start off with your primary care doctor so that it can send a referral. And I'm happy to see you for that. Now, with regards to your first question, because there's kind of a two-part question, and to where you'd see a non-surgical podiatrist versus a surgical podiatrist, you can see either or, because I have some non-surgical podiatry colleagues who would actually refer patients to me if the patient needs surgery. So I would say, of course, please come to me. But nonetheless, definitely reach out to a podiatrist. If you have a foot problem at all, you can see any podiatrist and who can help you with that.
Perfect.
Okay, and then I think we have one more question. So if someone was dealing with an ingrown toenail, for
Oh, yeah.
instance, because that's the hot topic right now. You see a lot of podiatrists treating more ingrown toenails. Like I've seen, I've read articles, or like I've seen treatment processes where people are flying all across the country just to get these things corrected.
Mhm.
So when would you recommend, if someone is, of course, someone may just think it's a hangnail. So when do you recommend for someone to come in and to see you?
So if you're having pain at all and you can't wear shoes and it's just pain with walking, definitely come in to see me. If there's redness, if there's any pus coming out of there, definitely come in as soon as possible to see me, because that means that you probably have an infection and you may need to have a small little procedure in the office where we take that little ingrown out and put you on some antibiotics to prevent further complications. But in general, most patients, just complain of pain. So if you're having pain with your toenail, just come in to see me.
Perfect. Well, that is all of the time that we have today. Thank you very, very much, Dr. Pierre, for speaking with us. And for anyone that's viewing or will view in the near future, if you have any additional questions, or if you need to schedule an appointment with Dr. Pierre, please call 615-341-4968. Once again, that number to call is 615-341-4968. And again, you are still available to ask any questions that you have for Dr. Pierre in the comments section. You may also visit our website at nashvillegeneral.org or nashvillehealthcarecenter.com.
Thank you to everyone who joined us today, and especially you, Dr. Pierre.
Thank you for having me.
Mark your calendars for our next Wellness Wednesday event, which will take place Wednesday, September 8th at 12:15. Have a great day, everyone.